Back, everyone. If everyone can have a seat, we're going to get started. All right, so I'm really excited to introduce our next group of speakers. As you know, this section is called Sell to Community. So what best way to finish off is to hear from our firefighters and hear how some of this research is being done in the community from our firefighters. So today we have presenting Randy Krause, Derek Urwin, and Darin Wallentine. So first up is Randy Krause. Randy has 36 years of experience as a firefighter and a leader. During his career, he has held positions of increasing responsibility across the career spectrum from firefighter to his current position as fire chief for the Port of Seattle Fire Department at SeaTac International Airport. Prior to coming to the Port of Seattle, Randy was the deputy fire chief of training, compliance, and safety for the Boeing Fire Department. As a respected subject matter expert in aircraft rescue firefighting, Randy has had the opportunity to influence aircraft national standards, regulations, and processes through various national and international committees and working groups. Then we'll hear from Derek Urwin, who is an engineer with LA County, a former firefighter trainer, and currently getting his PhD in computational mathematics from UCLA. And last, we will hear from Darin Wallentine, who's beginning in his fire service career in 1992. Deputy Chief leads the Tucson Fire Department Safety and Wellness Division. As a cancer survivor, Darin is passionate about Tucson Fire Department's involvement in cancer research and prevention through the Firefighter Cancer Cohort Study and the collaborative efforts with the University of Arizona, University of Miami, and NIOSH. In addition, after the three presentations, we will have a panel, and joining them will be Jeff Hughes, who is retired from Orange County after 35 years, currently working for Local 3631 as the wellness agent for cancer and behavioral health. So without further ado, we're going to start with Chief Randy Krause. Chief Randy Krause.
Good morning, everyone. Thank you for the opportunity to present today. I really appreciate it. And when Dr. Burgess asked me to present, I feel like it's a very important opportunity for us in leadership to kind of share our experiences and the importance of the relationship with researchers as they look at the fire community. A little bit about my department. I am the fire chief at SeaTac International Airport. I do have 36 years of experience in aviation, so dealing with mil-spec AFFF, which contains fluorine. And my department has also participated in the Firefighter Cancer Cohort Study, in which over 80% of my members voluntarily provided blood, urine, and saliva samples to Dr. Burgess and his team as they look at the specific area of PFAS. One of the things that I put this slide up here. One of the things that I find myself doing, and many of you as well probably do, in partnering with researchers, is I often have more questions than I have answers, and often find myself wondering why or what. I'm confused sometimes on where I end up being. Last week I spoke at a town hall for the National Academy of Sciences and Medicine, and one of the main things, and I find myself being really good at, and what the importance of us being engaged with researchers when they look at especially the fire department community, is helping them link to other contacts or your network to be able to help them answer some questions. And so I find myself being more of an advocate in finding answers and helping the researchers. I'm not technical by nature whatsoever, but just through my relationships with others throughout the world, as I've spent 36 years in the fire service, I'm able to kind of piece things together and get the researchers some information that they may not have otherwise had. I'm gonna focus basically on firefighting foam, AFFF mil-spec. My department has experienced 3 pancreatic cancer cases. One, I have to mention my brother, Gilbert Smith, who passed away in 2015 after retiring in 2013. So just 2 years after his retirement, he passed away from pancreatic cancer. Pancreatic cancer isn't one of the presumptive cancers in Washington State. However, through petitioning and appeals, Labor and Industries within the state of Washington identified possible exposures of Gilbert early in his career to PFAS foam was lined up so that he was able to, and his family were able to consider his unfortunate early passing as a line of duty death. I currently have one firefighter experiencing and battling pancreatic cancer. I have a long-term retiree that has experienced pancreatic cancer. And so it just drives and begs a ton of questions. So as you could see, when Dr. Burgess and team asked to come out, I had a ton of interest from my membership because of those specific cases, and it's so close to us that they wanted to know what it meant and how it looked. And one of the things that I spend my time doing is educating through the researchers, helping me understand, one, we may not have the answers today, but hopefully we'll have the answers in the future. So with my firefighters, it's about, yeah, we tested their blood, urine, and saliva. We have results. I'm elevated in two particular areas personally myself. And what makes me wonder, is it because of my experiences early in my career? Because we did wash floors with AFFF foam. We washed trucks with AFFF foam. We threw it on each other. The way we used to train with it is we would have to be fighting fires with hand lines with AFFF foam coming over the top of us. So just kind of by the nature of how we did our work in the late 70s, early 80s, it created those exposure opportunities for us. Just a picture showing not only is it the foam, but we're doing research and trying to help researchers understand what does PFAS mean within our system. So providing ourselves as subjects for that. And also we did some with NIOSH, with Miriam, we did some dermal testing with new sets of bunker gear, a very small sample of 10 firefighters through exertion and exercise to see if there was any possible migration from the bunker gear dermally into the system. So it's, for me, it's about if I could leave you with one thing, the importance of these relationships is creating a learning community, not only for us individually, but for the research as well, and making ourselves available to the researchers so that we can help them build data sets so that we can do something with that in the future. And what my team, and even I heard the word yesterday, I've been in and out of the conference, and my most tenured individuals really understand the importance of, one, they want to know what they were exposed to and how it's affecting them later in their career, but also setting a course for the next generation so that we can protect them and provide a safety envelope in some way, shape, or form so that they can be less at risk through whether it's engineering controls, PPE, how we doff and don our equipment, 2 sets of bunker gear, if we can do that and manage that, creating a clean station or clean and dirty areas within the vehicles and within the station. So it's really important that we be engaged, stay engaged, and keep an open mind to not only learning ourselves, but help the researchers better understand us. I look at PFAS in particular, and I just bring this up, one of the challenges I have is from a safety and health perspective, it's really a primary of importance for me, the fire chief, to really look out for the safety and health of our members, and working with the labor, the IAFF, both locally within the state and nationally has been very valuable and a great resource to be able to leverage some of this work. So really appreciate the work that they do and continue to do, and the support that we've had both locally and nationally in all things firefighter health and safety related. There's also another component in the environment. I find myself dealing with researchers and the communities dealing with environment, because not only is PFAS hazardous to health, it's also contaminates many of the drinking water in the areas where we have military bases and airports around the country. And then I'm also sitting in on the FAA advisory panel for performance. So we need a replacement for AFFF mil-spec foam. So we're trying to find a suitable alternative and trying to figure out a way to solve the problem and replace mil-spec AFFF foam with a fluorine-free viable solution that also protects both the firefighters and the public that we serve. One of the things that I have noticed within the space, and I continue to champion as a national strategy, one of the things that I find us bumping our heads up again with the research is that there's work going on in each of these bubbles, but there's really no one entity pulling all this work together. So I find myself at meetings dealing with health and safety. I find myself in meetings dealing with environment. I find myself in meetings dealing with performance. I just had a meeting this week with the FAA and really stressed the importance and need for a national strategy so that we can phase out mil-spec with fluorine and bring a fluorine-free foam in. And they're going to help me champion that. And I think it's going to take a legislative decision in DC to help us line that up. I show this screen just of all the different, this is just one area of research that I'm focusing on for the group today, which is PFAS and working with the Firefighter Cancer Cohort study. Who's not on here is the IAFF, which I wanted to just do a shout out to them, and again for all their support and help both nationally and locally. My team within my department, we do things shoulder to shoulder with our union leadership and executive board, and have been very successful in messaging to the troops the importance of being engaged, being involved, and helping with this work that's going out there. One of the things that I find myself, I'm not really that an advocate. I don't find myself in advocacy a lot, but I guess I do find myself in advocacy a lot. We, in the state of Washington, Toxic Free Future did a ton of work legislatively to ban the purchasing of mil-spec AFFF foam. So we have legislation within our state. I cannot use mil-spec AFFF foam with fluorine for training purposes. I can only use it for emergency response. What I really applaud this environmental group for doing is, one, the advocacy to get it banned, but also helping us work to find a solution. They were very key in helping our union body here, specifically in helping the state recognize Gilbert Smith death as a line of duty death. So can't say enough about them. Why are partnerships important? It's connecting with the research community. And then I've just recently with Dr. Burgess, for you researchers out there, if there's information that you're not getting, or there's things that you're looking for that you're having hard access, the fire service as a community can be very protective until you share a name that they know or a mutual contact. And that's where I've been finding myself to be of value to this research. And Dr. Burgess shared with me in one of our ongoing meetings for the Firefighter Cancer Cohort study that they're having problems or were denied access to a certain fluorine-free foam. I knew the regulator in Europe that drove that change, who had a relationship with the manufacturer and was able to help them get that release. So I think for you firefighters in the room, don't underestimate your contacts and the value of those contacts in helping with this research, because often I may not have the answer, I might not have what they're looking for, but I'm able to kind of line that up for them to help them find solutions. And recently I had a meeting last week with the Department of Defense, and they were looking for contacts of users of fluorine-free foam. So I put him in contact with Chief Gary Bartram from Heathrow Airport, who's transitioned very effectively. And so created a dialogue there. And then he has access to other airports around the world that have transitioned to fluorine-free foam, and putting them in contact with them. So learn about, and it's also a great opportunity to learn about the great work being done on our behalf. I think it's really important. I applaud the researchers for all the work that you're doing in support of us. That's very important, and we're very appreciative and very humbled, because traditionally the fire service was not as open, and we're starting to become more open to understanding and helping you help us. And being open to what is possible, open-minded, getting answers to reduce risks in the future. And it is the right thing to do for our members and the community. And for me, it's first and foremost, it's about being in the game. That's really, really critical and important. Some of the challenges that I see: communication, the culture, and we have done things just because that's how we've done things. Lack of big picture perspective. And one of the biggest challenges I see is operationalizing some of the outcomes, because maybe we can't do anything now, but at some time in the future we can. We don't know what we don't know. And then I think that's all I have for today. Thank you for the opportunity, and really appreciate you guys providing both the in-person and virtual format. That's fantastic, because we out here that can't, that still have travel restrictions, get the opportunity to participate. So thank you very much for that. And thanks for the opportunity today. And I wish you all well.
Thank you so much, Randy. And so now joining us from New Zealand is Derek Urwin.
My name is Derek Urwin. I'm an engineer with LA County Fire, currently on academic leave while completing my PhD in chemistry at UCLA. And I'd like to talk about how the fire service can work with the academic community to make some real progress in our cancer prevention efforts. So we in the fire service are problem solvers, right? You can throw anything at us, from a fire to a cat stuck in a tree, and we'll work without rest until the problem is solved. And we do that because we're duty bound to protect the public. But we have to remember that we're also duty bound to come home healthy to our families. So as firefighters, we have to look at cancer in the fire service as yet another problem to tackle, because standing by and hoping that some smart people are going to come along to figure it out for us isn't going to get us anywhere other than to more funerals for our friends and colleagues. So if you know me, you've heard me say this before. I'm a firm believer that anyone can learn anything. You just have to be motivated to do it. So there's nothing stopping us in the fire service from getting the science done to reduce our incidence of cancer. But as firefighters, we don't go at any task alone, right? We work as a crew, each of us with a role to fill in order to achieve an objective. And the same thing applies to tackling cancer in the fire service, where we need the academic research community to be part of our crew. Now, I specifically mentioned the academic research community because that's where you find good scientists to work with. The same way you're always looking for good firefighters to work with, because you know you can count on them. So it's the academic community where you're going to find scientists who are not out for financial gain, who subject their work to peer review, who are governed by ethics, whereby our health and well-being in the fire service comes before anything else when you work with these people. So putting these two groups together, motivated firefighters and upstanding academic researchers, is where the Firefighter Cancer Cohort study has done something really special. But I want to make the point to my colleagues in the fire service that this is not an exclusive club, right? All you have to do is reach out and put in the effort, whether it's with the Firefighter Cancer Cohort study or a different team of researchers. It's we as firefighters that can facilitate the research needed to reduce our incidence of cancer. Now, you've heard a fair amount about the Firefighter Cancer Cohort study from the amazing group of scientists that have organized it. But I want to take a minute to give you the firefighters' perspective on why this endeavor is so important. So first, the Firefighter Cancer Cohort study strives to identify the mechanisms causing cancer at such alarming rates in our profession. Firefighters are given the opportunity to steer research in directions that are important to us and to engage in getting that research done, which is actually very unique. And probably most importantly, the Cancer Cohort study strives to advance the state of the science so that we can identify cancers early and hopefully improve treatment outcomes. Now, the key to accomplishing all of this is these blocks here that you see in green, which is our participation as firefighter researchers, whereby we're not sitting around hoping that somebody's going to come along to collect a post-exposure biological sample to analyze. We make that happen ourselves. That way our academic research partners get all the data that they need. So how is it that that happens? Well, after the necessary IRB framework was established in LA and Orange County, we were able to get firefighters certified to enroll fellow firefighters into the Firefighter Cancer Cohort study. And with the support of our medical director, we're able to have our firefighter paramedics do all of the phlebotomy needed for the study. And this is actually a money saver, right? Because research dollars don't have to go towards travel or personnel costs and can instead be used to include more firefighters in the study. Now, there's a number of challenges to post-exposure biological sample collection in the fire service. And if you take, for example, a large brush fire, where we're likely to have study participants spread over a large geographic area, conventionally, a team of researchers would have to scramble to get the timing and location right for sample collection. And I can tell you from personal experience, having tried it that way a couple of times, you lose the opportunity or you lose the chances to collect a lot of the samples that are out there. And it's really heartbreaking from the point of view of trying to get the work done for firefighter cancer prevention. So what we as firefighters can do is solve problems, right? We can pre-equip our apparatus for research activities with something as simple as a small cooler with urine cups, so that when an incident does occur, the vast majority of our research participants are able to facilitate field research over even massive geographic areas that you'd find in a brush fire. And this way we don't miss any opportunities to collect samples because of distance and timing. Now, one key point about this model, this way of doing research, this community-based research between the fire service and academics, is that you empower your firefighters to not only enroll in a research study, but also to facilitate its execution. And this results in dedication to the study, dedication to make it work, dedication to keep it going. And that's something really special, right? It builds its own momentum. So this is me and my good buddy Jeff on, I don't remember which brush fire in 2019. But in the fire service, you know never to show up without equipment in hand and ready to work. So what's actually going on here is a field exchange where I had to put in the work to hike a couple hose packs up to a strike team to then trade for a portable cooler of post-exposure urine samples collected earlier in the day. And while I'm making a bad joke here, the real point is that these post-exposure samples, these in particular, wouldn't have been possible. It would have been totally impossible to collect were it not for the firefighters on this strike team 1103, being totally devoted to making the cancer cohort study work. So it ends up being a really special partnership between academics and firefighters. So when all's said and done in the field, we're able to package up samples and ship them off to our research partners, and that's where the other half of the work gets done. Now, in addition to working towards catching cancers early and improving treatment outcomes, one of the most important things we have to do is implement research-based interventions and policy changes to reduce our exposures to chemical carcinogens. But it's really important that we understand the published research from our academic partners in full and in depth. For example, we have to recognize that while post-incident decon might remove upwards of 80% of contaminants from our PPE, that does not equate to an 80% reduction of chemical carcinogens absorbed into your body. To make more progress on that front, we actually have to physically remove sources of exposure wherever possible. In many ways, that's hard to do in the fire service because we have a job to do, but nobody said that this undertaking was going to be easy. And in the fire service, we don't shy away from hard. But there is low-hanging fruit, right? There's simple things that we can do, like moving gear lockers off the apparatus floor, which unfortunately a lot of places still struggle with accomplishing, or not using engineered wood products bonded with synthetic resins in live fire training, which should be a no-brainer. So to seriously make progress on our cancer prevention efforts, we have to put the effort in as firefighters to delve into and really understand the science. And it's not hard to do. I'll tell you, I went back to school when I was 35, working full-time, married with 2 kids, and it's doable because we in the fire service inherently are a family, and you'll have the support that you need to get the things done. It just takes some work, right? Left foot in front of right foot, just like on a fire, until it's done. So anyway, that's it, and thanks very much for your time.
And to finish off, we have Darin Wallentine.
Well, good morning. In my presentation, you're gonna notice a theme, and so I'm gonna take just a just a few years ago. So exceptional partnerships act as a catalyst for each member to grow and succeed. Is there a clicker? Or is it? Next slide. Thank you. I say next slide and it happens. So our fire service culture, this is one of the biggest challenges that we have, especially with the Tucson Fire Department, rich in history, rich in tradition, but you sit across from the researchers in some of these meetings and they ask you why. What's the answer? We've always done it this way. This was a humbling experience for us at the Tucson Fire Department when we were then challenged by our research partners. So we don't know what we don't know until we have this opportunity when we partner with the researchers. Now, within this partnership with the University of Arizona specifically, we look at this more as a relationship, and relationships are built on trust. Our partnership and relationship with the University of Arizona began back in 2007 when we had an outbreak of MRSA. We reached out to the College of Public Health. Dr. Kelly Reynolds and her team was able to help us guide our process so that we could then develop interventions that would then mitigate the issue that we were facing with a handful of our members who developed MRSA. So we no longer have couches that are made of cloth. We are given decontamination practices that will help us keep this at bay. And surprisingly enough, MRSA dropped off significantly when we start to put in these interventions. In 2009, we had a study that evaluated injuries within our department. This injury prevention has now resulted in power cots, and we've seen back injuries drop off significantly as a result of lifting and lowering gurneys. In 2012, again, we reached out to the University of Arizona, and we partnered with Dr. Patricia Haynes and the College of Health Promotion Sciences. She's helped us develop a behavioral health model for our department. You see a trend here? We can't do it ourselves. We cannot proceed and be the ultimate problem solvers like Derek suggested without the assistance from those who can help answer the questions that we have. And Dr. Burgess will say constantly in our meetings, Darin, John, you guys run this. You guys ask us the questions, we'll help you get to the finish line. So my emphasis today is that for all of you, start thinking about those that you can reach out to in your department, whether it's the local university or those colleges, because they're going to help you, especially when you sit around that kitchen table at the fire station and try to explain why we've got these green buckets on every fire truck. Why are we using this to wash down our firefighters? Well, then you can start pulling out PAHs and polycyclic aromatic hydrocarbons out of your toolbox of throwing them these terms. But the point is, you'll understand why we do what we do because the researchers have helped us get to that point. So changing our perspective is what the researchers challenge us with when they ask us why. Developing that research mindset, I would suggest that when I started my fire service career back in 1992, I had no idea that I would be in the position that I'm in today, leading the Safety and Wellness Division for the Tucson Fire Department. But this has given me opportunities and my team to work with the research partners. Next slide. So within this collaborative research, back in 2014, we had the opportunity to partner again with University of Arizona on the FEMA-funded cancer research study where we actually measured post-fire biologicals for firefighters. It was a 3-year study where we were able to then come together and then be able to publish the research that is now potentially going to help the entire fire service be able to present this at IARC to actually make changes that's going to change the fire service as we know it. there's nothing more than I can hang my hat on as being an opportunity that could change the fire service. That's more significant than anything else that I'll probably do in my entire career. So with that, it's okay. Developing this research partnership can be just as easy as making a phone call, sending an email, and it could provide huge benefits, not only to our firefighters in developing some of these research practices, but how many times have you walked the floor at FDIC and all of the products that are sitting out there, enticing the unknowing firefighters and fire chiefs? You're gonna walk by the sauna and go, do I buy a sauna? I mean, what's the research say? The point that I'm trying to drive home is we need our fire service professionals to be professionals and learn and be able to discern what is the shiny object or what is peer reviewed, what's validated, what's good science for us to then move forward. Because when we go to spend money on a second set of turnouts, that has to be based in science. If we're only gonna use water, a bucket, dish soap to wash down our firefighters, but Kenny Fent says that could remove up to 85% of the PAHs that are on your gear, that is a very inexpensive intervention. So my encouragement to all of you is that if you have not sought out a research partnership within your department, you're gonna be significantly challenged, especially when you're sitting at the kitchen table, explaining to your firefighters that you don't know how to approach this, but you have those resources that are available. And at the very least, all you gotta do is say Jeff Burgess. Thank you.
Thanks, Darin. That was a great presentation. Okay, so now we have everyone. Randy and Derek, can you hear us?
Yes.
We have everyone. Randy and Derek, can you hear us?
Yes. Yes.
Yes.
Oh, awesome. Okay, so we have everyone here. So to start off, one of the questions that came through is, how do you sustain a long-term research partnership?
It doesn't hurt that I've been in my position for some time now. And for Captain John Galata, who's really been our champion in our safety and wellness division, for him and the time that he's been in his position, which is probably more than 10 years, that has been a significant way to keep that partnership going. Because the professors at the University of Arizona oftentimes don't change frequently, not like in the fire service where you're 2 years in a spot and then you're out. But that consistency is something that we value, and that's just what happened for Tucson.
Anyone else want to elaborate?
I would just add, I'll go ahead, Derek. I'm going to just add that it's really important to build the bench behind us as well. So not only are we leading out front and maintaining these relationships, but it's creating those behind us so that they can carry on while when we're long gone.
Yeah, and if I could just add, when I first started off, like any firefighter who wants to do their job and is devoted to it, you kind of think you have to do everything yourself. You have to get it done yourself. And as our participation with the cancer cohort study went along, it's getting bigger and bigger and harder to manage. And all I had to do was just kind of raise my hand, and my door got kicked down with dozens of firefighters that wanted to help facilitate the study. So building a working group of fellow firefighters is just so key, and it really facilitates actually doing more work, as opposed to just trying to be a hard charger and doing it all yourself.
Great. So what are the strategies you use to translate the technical jargon to the firefighters?
I refer to the smart people. When it comes to Dr. Burgess and the teams at University of Miami, I reach out to them constantly with those kinds of questions to dummy it down so that, I understand it enough that I can explain it to our people.
we have had opportunities where we've been able to have our research partners, whether it's graduate students or those who are working on the research team, to do ride-alongs with our crews, because it's their questions that help lead this and guide this. And then if they hear the consistent message that's coming from the researchers, and it's the same thing that we're also saying in our safety and wellness division, it builds that credibility within the organization. And nothing gets through the fire department faster than tell a friend, tell a firefighter.
Or you could just do what Derek did and go back to school to get your PhD.
Jeff and I are good buddies. We like to tease a little, but if I could just add to that too, one of the things that we tend to do in the fire service is kind of say like, hey, I'm just a worker. I'm a neck downer. And I try not to let my friends and colleagues off the hook when they say that, right? Because that's taking the easy way out. What we got to do is encourage our colleagues, our friends, our families to take the time, put in the effort to understand that technical jargon, because it really isn't that hard when you put the effort into it. And what it does is it increases awareness, which is so key. Education in any form is so key. So I'd say we just don't let each other off the hook.
Great advice. So something that came in from online, in the panel's mind, what should be the prioritized research areas over the next 5 years? For example, improved exposure assessment, toxicology research, intervention, prevention strategies. So what do you guys think are, the next things for the next 5 years?
If you don't mind. The science really drives the education, the prevention. Obviously, the IARC issue is something that is massive for the future of firefighters. Many firefighters have passed along that little saying, right, that profession is something that's unchanged by science and research in the last 200 years, right? Those days are over. Science should be looked at as driving the future of not just the current generation, but all generations to follow. Safe practices that can protect ourselves, our families, our children. There's nothing more important in the future of the profession than really the science behind what's actually going on in our profession.
Great. Anyone else?
Somebody actually answered the question. I just said something else.
Okay, last question that came through. What if I'm not near a university? What should I do? Any suggestions?
You do know how to Google, right? Sorry, don't mean any disrespect. So we've had in preparation for Dr. Burgess suggesting that we participate in this presentation. I would challenge all of our fire service partners. You have access beyond what you can even imagine. I mean, there are opportunities, whether you're working for Nashville Fire and you reach out to Vanderbilt. If you're working, at Port of Seattle, or you're in Seattle, at Seattle Fire, you have University of Washington in your backyard. This framework that I described for Tucson with the University of Arizona in our backyard, I would really challenge career volunteer departments that you are only limited by your own mindset, by your own thinking.
There needs to be that slice in the geography of the U.S. that the science isn't just going to study one department. And so the fact that the outreach, John and Kepra with Tucson were just back in FDNY delivering, or not delivering, but actually taking biologicals. So the testing and the science oftentimes will go to you because you are of value in their, research that needs to be broad. So reach out, do your homework. And like Derek said, create opportunities for yourself to help in the science of this important work.
Yeah, if I could just add to that briefly, all the work that I was just describing that Jeff Hughes and I have done together, right? We're in Southern California where there's no shortage of universities, but all the work that we're doing is in conjunction with the University of Arizona, the University of Miami, NIOSH, none of which are local to Southern California. So all that work that we've done is, firefighters doing the legwork in the field. And then it's really as simple as getting an IATA shipping certificate to be able to ship biological samples to those university researchers that, like Darin was saying and Jeff was saying, could really be anywhere in the country. So not having a university down the road really it's not a limiting factor. If you can pick up the phone or you can send an email, you can make it happen.
If I may just add, one of the things, I share the NFPA 1500 series documents. One of the biggest challenges that we have is getting adequate public input. We're working on a contamination control document right now. So I encourage those that may not have resources readily available. I think they're more readily available even at a distance than they really realize, but it's participating in the public comment, because NFPA is very open and transparent, puts those documents out there to get public input, being able to provide that input to help guide us as we try to create standards that that take advantage of the science and all the research that's done, so that we can create a safer environment for our firefighters and their families. So just highly encourage participating in that public comment.
That's great. Thank you guys so much for your advice, for your feedback, and great presentations. Thank you.
So now we begin our afternoon sessions. That was fantastic to really hear how our firefighter partners can help, make that synergy happen with the scientific community. It's really a shared partnership where you tell us the research and we use our tools to make it happen. So we're thankful for your words and your guidance for firefighters that are listening to us abroad and from far away. All right, I've got your instructions for your lunch, so it's only me holding you back from enjoying some food. So for our virtual attendees, starting at 12:20 p.m., you are encouraged to join the virtual lunch table to meet and talk to other virtual attendees who are with us virtually. The link is available to you on the Cvent platform. After lunch beginning at 12:30 Eastern Standard Time, we'll break into 4 different tracks. So there's 4 different pathways that you can join this afternoon. Each track will focus on a different subgroup within the fire service. So if you're interested in wildland and wildland urban interface firefighters, that will be track A, and that will be in POMS CD. So you might want to grab a pen and paper and write that down. So track A will, for the topic of wildland and wildland urban interface firefighters, that will be in the room POMS CD. For individuals interested in arson and fire investigators, that track will be in POM B, as in boy, or beta, if you're a firefighter. Track C, structural firefighters, career and volunteer, will be in Cypress 1 and 2. So track C, structural firefighting, both career and volunteer, will be in Cypress 1 and 2. And track D, our fire trainers and fire instructors, will be in Cypress 3 and 4. Each track will have several presentations, with one presentation focusing on real-world scenarios and best practices. If you are joining us virtually, please remember to select the preferred track session on the Cvent platform so that you can be directed to the appropriate topic area on track of your choice. These tracks are running side by side to each other. So instead of having one dual track, as we've been doing these last 2 days, there'll be 4 tracks and you choose your pathway of which one you want to go to. So for those in person, you'll be directed to the track room of your choice after lunch. Our staff will be outside guiding you to the appropriate room. After the track session, we're going to have a break and then reconvene in the full group to hear a brief recap of each of the sessions, followed by a Q&A session. So bring your questions and be ready to ask. All right, please enjoy your lunch. Buen provecho.
The tracks will begin at 1 p.m. So there's an update to the schedule. Tracks will begin at 1 p.m. So we'll break for lunch now. Please be in the area, either in your Cvent room if you're virtual, or in the designated room here in person by 1 p.m. Thank you. Enjoy.
I had one job.